Kansas health officials report 2,400 new cases of COVID-19 since Friday. It's the most they've seen in 3 weeks. New cases in Missouri are down a bit from the weekend, with 1,500 new cases reported on Monday. And new guidance from the CDC may have you rethinking how you interact with people. The CDC expanded its definition of a close contact of COVID-19. At first, health experts said that if you'd been in close contact, it's if you had spent 15 consecutive minutes with an infected person. Well, now, a new study shows it is cumulative. The time near an infected person adds up. Brief exposures throughout the day can put you at the same risk. A member of the COVID response team at St. Luke's says as we learn more about the virus, changes in health and safety guidance follow.
I think it's going to impact some of those times when you're with a group for a longer period of time, but kind of broken up through the day. So potentially at work, say you see someone for 5 minutes in the morning, 5 minutes at lunch, 5 minutes at dinner, that would fall into a close contact now.
That's Dr. Sarah Boyd, who says that expanding the criteria for close contacts means expanding contact tracing. With the number of COVID cases and hospitalizations rising, she hopes that people take this guidance and other recommendations seriously. By the way, nursing homes and long-term care facilities have until the end of the week to let the federal government know if they want to be part of a COVID vaccine program. It's part of a plan by the CDC to vaccinate people in nursing homes without requiring residents to leave the facility. CVS and Walgreens are in charge of one nationwide effort to bring vaccinations to nursing homes. The head of an organization advising long-term care facilities says the CDC is trying to be proactive.
They are trying to create a network so that when a vaccine is discovered, it can be safely and effectively pushed out to the people who are the most affected by it.
Well, private pharmacies and other health organizations can also help vaccinate residents in facilities. Well, how to pay for that is still under consideration. And pharmaceutical company Pfizer has now expanded its coronavirus vaccine trial to include younger children. As part of its trial last week, Cincinnati Children's Hospital vaccinated 100 children as young as 12. The move comes a month after Pfizer lowered the participation age to 16 with the goal of including several thousand older teenagers. Doctors say they can test the vaccine based on the safety data they're getting from the 30,000 adults who already got the vaccine. Pfizer is the only leading drug company testing a coronavirus vaccine on minors.